Hi, Akemi. Nick here. Thanks for joining us today. Why don't you go ahead and just introduce yourself and tell us a little bit about the work that you're a part of right now.
Perfect. Hi, Nick. I'm Akemi
Hmm.
Wijayabahu. I am a third-year Ph.D. student. In
Okay,
2015, I came from Sri Lanka to do my master's here in the same Department of Epidemiology.
great.
So for my master's, I did epidemiology with Professor Walker.
Hmm.
And for the dissertation, I looked at how different gut microbiota or the bacteria living in the gut changes with racing intake. That was an
Hmm.
interesting project. And then after I finished my master's, I did my PhD here with, for the first 2 years, I looked at different risk factors
Okay.
that are associated with breast cancer, specifically breast density, with
Hmm.
Dr. Lucy. And right now, my focus is on different nutrients and how they impact telomeres. And I have two amazing co-mentors, Dr. Robert Cook and Dr. Walker Mine.
Hmm. And
And
so
when I'm
now,
yeah.
right? So now we're recording this on Monday, April 27th, 2020. So do you still have that research going on, or have you recently added some COVID-19 work as well?
So we do have the research going on for my dissertation, and also I
Hmm.
have research assistant duties for both my co-mentors. And while when I'm not doing my classwork or research assistant uh, work, what I
Sure.
do is I assist Department of Health in contact tracing and case investigations.
Gotcha. Could you maybe kind of give us kind of a brief background for those who may not be in epidemiology of what contact tracing involves?
So when we say case investigations, which is
Hmm.
contact tracing, is also part of case investigations.
Hmm.
Um, so for case investigations, what we do is the Department of Health in Alachua County, depending on their need,
Hmm.
they assign set of cases to our supervisor, Professor Shapiro,
Hmm.
and she assigns, based on our availability, cases to us. So when we have
Okay.
a laboratory confirmed positive case, what we do is first we call them,
Hmm.
and there's a specific standard Department of Health screening form, which
Oh,
is
okay.
a questionnaire, um, and we ask them these. We administer this questionnaire
Hmm.
that allows us to determine their infectious period,
Hmm.
and then uh, who they may have come into contact with during this infectious period, some of the risk factors that they have, where they might have got this infection from, and what would, if they went to healthcare facilities, were they wearing masks, did the healthcare providers, or uh, the basically what are the types of contacts they had
Hmm.
during the infectious period. That's what the case investigation is about.
Gotcha. Okay. So then, as a student, and correct me if I'm wrong, when I spoke with Alyssa last week. So this is kind of a temporary, like paid position with the county or state. Is that right?
So for us, I'm an international student,
Okay.
so we can't work outside of UF and
Okay.
not for more than 20 hours. So, uh, but since we were interested in learning new things, Professor
Hmm.
Shapiro had this amazing idea to
Hmm.
create a course of field epidemiology. So in that way, we can legally assist and contribute to the society and also learn from.
Oh, okay.
So what we do is voluntary and not paid.
I see. Okay. But you're accruing some fieldwork course credits.
Yes, we do.
Yeah. So you've been, how long have you been then assisting the county then in the field?
So when we say field, it's online,
Sure. Okay. Right. Right. Yep.
right? So I have been doing this for about a month.
Okay. And
We had
then,
a quick crash course from Professor Shapiro to do contact tracing. Before that, we didn't know about it. I didn't
uh-huh.
know about it that
Oh,
much.
okay. So what have been the interesting things that you've learned now, if you've uh, been involved with the contact tracing for going on 3 weeks? So what have you learned now that you didn't when you first started?
So it's interesting. There's a specific script we have.
Mm-hmm.
These are the things that we have to assess, but different people have different living situations, and
Sure.
the lives may be different, and they may have diseases associated with stigma. So we have to be very careful, and when asking questions, and we have to be very respectful. So
Mm-hmm.
we have to like improvise based on the situation, and
Interesting.
also get the information that we really need.
Gotcha. So when folks are positive, do they know that you'll be calling and asking these set of questions?
So most of them do. Most of
Okay.
them will be informed by their healthcare provider that we will be giving them a call. Some may not. It depends on the person.
Mm-hmm. Yeah, I'm
But
sure
the
that.
majority of people that I've contacted, they knew.
Right. And then for each of these cases, or the work distributed by the county, I guess how many? Let me rephrase my question. How many cases might you take on in a given day or week?
It depends. I can't give you an exact number that how many cases we get or I
Mm-hmm.
get, because it depends on my time availability as well, because we
Sure.
do have classes and also research
Mm-hmm.
assistant work, and also it depends on their need as well.
Right. Okay, that makes sense. So when you're speaking with folks over the past couple weeks, I'm sure there could be some very sensitive and difficult conversations you might have with individuals. Can you speak to anything that's might have been a little difficult to improvise, as you're speaking with people and learning about their stories?
So one of the things, this is not majority of the cases.
Mm-hmm.
Majority of the cases are very compliant, and they would answer questions, and they're very receptive to what we're doing.
Mm-hmm.
There are some of the patients or cases, people who are concerned about their privacy. So in
Oh,
such a case,
sure.
we have to kindly explain that whatever that we are doing in contact tracing and case investigations is confidential, and all the information will be assisting in mitigating the
Mm-hmm.
transmission or breaking the transmission cycle.
Sure. What have you gotten a sense of like what people have the most difficulty with when it comes to, you know, they're tested positive, then you might reach out to them 5 days after their positive test. Like what do you get a sense of now that you've talked to so many families in the field now for the past 3 weeks? What are the folks who are tested positive? What do they have the most difficulty with?
Um, if I understood right, are you asking whether comprehending information, like whatever education we
It
provide,
could be
or
anything. Like, is there, I know you have like a script that you follow and everything, but is there maybe, um, they have different socioeconomic statuses, of course. So, like, is there anything that maybe people might share on their own that might be out of the script, out of the regular questions that you might ask that you're learning that, you wouldn't think about, from news stories or updates that we see online?
right? So when I said before that different people have different living situations,
Mm-hmm.
that some people may be easily socially or physically isolated if they're living with their family members or
Okay.
roommates or something easily,
Mm-hmm.
but some it may not be very feasible.
Sure.
Like say for a two-story apartment or two-story house, it's much
Right.
easier to physically distant, but it's not the same for a person living in a two-bedroom house with many individuals living in the same house.
I see. Okay. So when you're on the phone, when you're speaking with people, you're kind of like your main task is to just get through your questions and identify um, new individuals that could have been, I guess,
Contacted,
yeah,
like
in contact, right? Yeah.
so.
Um,
In the case person, when we first talk to the case, the COVID positive
hmm.
person, we get the list. We make a line list with who
Sure.
they have come into contact with, their contact details,
Hmm.
so that when we complete the interview with the case patient, we go back and one by one do the contact tracing for each and every contact they
Hmm.
had. And we assess whether they are symptomatic, if they're symptomatic, where they work and what contacts they had, and
Mm-hmm.
determine, discuss with them how long they have to self-isolate,
Mm-hmm.
things like that.
Sure. Yeah, I imagine that could be if you contact somebody who has a small family or a small social circle, then that phone tree would probably end rather quickly. But then if you run into families that are have a large number of family members, and that that one trace that could take you all day or all week.
Not just family members, it could be like work related.
Oh, right, yeah, and then
Some
work
of the essential
coworkers. Yep.
workers.
Mm-hmm. Um, so as a third year PhD student and an international student, um, is your program a 4 or 5 year program?
It's a 4-year program.
4 year program. Okay. So how has this kind of recent set of volunteer fieldwork responsibilities, and in addition to ending your third year here, um, in the next week, how has that affected kind of your overall experience, as a student at the University of Florida?
So the volunteer work doesn't interfere with my
Oh,
classwork or
great.
my research assistant work. I
Mm-hmm.
take time after I do. We work until like 9 p.m. and
Okay.
weekends, but it has increased my learning experience.
Mm-hmm.
Especially, it was exciting to do this kind of field work because that's the start of the modern epidemiology with John Snow starting with the cholera epidemic. So it was
Right.
really interesting and exciting.
Yeah, it's this is it. This is real life. This is the
It
once in
is,
a lifetime opportunity that you'll be able to look back on and say, "Wow, I remember." I don't know when the quote the post pandemic life will begin for all of us, but
right.
I think it's a very unique and fulfilling experience, at least academically and professionally, to be a part of something as important as contact tracing.
And also socially, it gives us
Hmm.
the sense that we are helping and contributing to the society in some a
Hmm.
way that we really can as epidemiologists.
Sure, yeah. And with the work here, just to maybe clarify, is there an IRB that's attached to the work that you're doing, or is this just kind of just what the industry needs, and so this is just a contract set up through the university and in the form of field work for you?
So you're asking about this contact tracing and case investigations that I'm currently
Right,
doing?
right. Is that part of any specific research project?
No.
Okay.
So this work we do is simply assisting the Department of Health in mitigating the transmission, and it is
Mm-hmm.
not related to any research. So we don't have
Sure.
any PR base, and all the information we collect is confidential and will be transferred to the
Sure.
DOs.
Yeah. And so are you serving then just Alachua County, or do you maybe receive cases from across the state of Florida?
Alachua County.
Alachua County only. Okay. Well, this is all, very exciting work, Akemi. As it relates to, we do these interviews and webinars, as it relates to like health and wellness, and you have a unique perspective being, international student in third year. You're almost there. You can see the light. Only a year to go. It's hard telling what the next year will look like. But is there anything, related to like health and wellness and your overall well-being as a student that maybe that you have like a new insight about, or a new appreciation for, or wish you had better resources?
Well, I would say to international students, and not just international students, everyone,
Mm-hmm.
domestic students as well, or staff members, that uh, don't be, you can be afraid of the crisis, the current epidemic situation, but take
Mm-hmm.
this time, stay at home time to spend uh, more time with your family members. If you're
Mm-hmm.
living alone, just do meditation or just enjoy this time and just reflect self-care. And
Yeah.
yeah,
So
you
maybe
have,
you had a lot of those supports in place, pre-pandemic, so you're able to kind of maintain then.
pardon me, sorry.
So you were able to, it sounds like you probably had some of those supports in place pre-pandemic. So once it hit, it was easy for you to kind of, maintain your healthy routines and everything.
Yes, and there are so many great resources that given
Mm-hmm.
by UF, and I'm in graduate housing. So they
Mm-hmm.
also have specific resources for residents, not just the graduate residents in grad housing, but also for undergraduates. There are so many resources like how to do Zumba at home or
Mm-hmm.
how to meditate at home, things like that.
Right. Yeah. I mean, that's just so encouraging to hear, for, future students who may watch this video, or current students who's, going from first to second year, second to third. I think it's great to hear, we need more good news in the world. And it's nice to hear that, you can do some volunteer work, some field work, and maintain, a high level of research and standards in your study. So thank you for sharing that. So is there anything, that maybe you want to close with, as far as what you're kind of looking forward to in the next year, what you're hopeful for, or anything kind of related to about our discussion that we haven't covered yet?
Immediately, I would like to tell everybody who's listening to this
Mm-hmm.
webinar that if during this COVID-19 pandemic, if anybody from the Department of Health contacts you for contact tracing, please be sure that all information is confidential,
Sure.
and your help will mitigate the transmission and break the transmission cycle. So
Mm-hmm.
please help us out in that way. And also for future, I hope that I'm gonna be graduated in
Mm-hmm.
the time that is set, and that this COVID-19 pandemic is not gonna be a big interruption, and which it has not been so far. And I hope it continues to be that way.
Yeah. No, I think that's a great I think it's a great public service announcement. And Akemi, I think that's all I had for today. But thank you so much for joining the webinar, and appreciate your hard work. And yeah, I really
Thank you
thank you for
very
your
much.
time. You're welcome.